Let's dive into the discussions shaping the nation.
Thank you, Corla. In the first instance, I want to recognise Cara Dermody, a person who I met when I was Lord Mayor of Dublin and indeed brought into the Mansion House as part of our initiative then to make Dublin the world's first capital city that will be autism friendly. And Cara is a person of determination, a brave person, but I absolutely lament the fact that she feels that she has to sleep outside the Dáil for the next 50 hours in order to highlight one of the big challenges that we have in this state when it comes to the delivery of disability services, and that is the assessment of need process. But I do think it's important to highlight the areas where we know the state have delivered improvements when it comes to supporting children with need. We know that a child who's in a preschool setting has an AIMS programme that supports staff to identify need and then gets supported by that AIMS programme to ensure that where there is a need that's identified, they get the appropriate services that they need. We know at a primary school setting that we have tooled up our schools with SNAs, that we've increased the number of autism-friendly classes, special classes in schools, and we've increased the number of special schools with so much more to do to ensure that every child of every need, irrespective of whether they have an assessment of need, are getting the type of education that they do need. And yet there's so much more to do. And we know that at third level education, significant changes have been made in the way in which we deliver third level education and access to education. But we know that the law, as it relates to assessment of need, simply isn't working. It's a law that is being broken 94% of the time based on the figures that the HSE have produced. And that's not good for anybody. But I think, Minister, you did highlight an important factor in your statement before this House, that it's so important that parents out there know what services are available to them with or without an assessment of need. That doesn't dilute the absolute requirement that we need to get this right as a state to ensure that every child's pathway is on an appropriate one, that we've identified the level of need that every child does require. But we equally know the systems and the moments when children interact with the state, whether it be with their public health nurse and in their developmental checks, and how can we improve the pathways direct from that check to supports that that child needs? How can we improve the pathways of services from a child who's been identified with a need in a preschool setting? How can we support primary schools and secondary schools where needs have been identified? And I do think Minister Helen McEntee's initiative of prioritising therapeutic services with a direct delivery in schools, we know from the programmes that the NCSE are already delivering in schools that that is making a big difference. And one of the big differences that delivering direct therapeutic services in schools can do, it can actually reduce the pressure on SNAs and teaching staff because children get the services that they need to support them through their education pathways. And similar approaches need to be adopted, not just in the special schools where I know projects are being piloted and where in the programme for government we've made clear commitments, but so too also to mainstream schools, so we don't arrive at a situation where in order to get services, parents are trying to perhaps find a setting for their child that may not in fact be the appropriate one, but they know that they're going to get the supports that they need. I also think we as a state need to support all of those parent support groups that every one of us in this House and outside deal with as constituency TDs who support children in their locality. In my own constituency, from Involve Autism Dublin 6 West to Neurodiversity Ireland to Neurodiversity Irishtown, Ringsend and Pearse Street, they do extraordinary work on their own, and perhaps there are better ways in which the state can support them in the work that they do to support children. But I just want to say this, that I absolutely support Cara Dermody and what she's doing. I think she's a determined woman, a determined young lady who has already done too much in terms of what she should be doing as a child, similar to so many parents who've got children who have needs that are out there campaigning all the time. What we need to do is deliver the services that every children in this state have an entitlement to do. And I know that you're committed, Minister, to improving how we deliver the assessment of need process. I welcome the announcement you've made there in terms of the domiciliary care allowance, but I would ask that, that the whole method in which the domiciliary care allowance is awarded, that increased flexibility is afforded to it also, because we all deal with parents who have been refused that domiciliary care allowance on the first point of entry and subsequently are awarded it at a later appeal, and yet the bills have been mounting in terms of how they've been spending their money for private SLTs and OTs. And of course, recruitment here is going to be absolutely key. And in replies that have been given to me in terms of how many OTs and SLTs that we've recruited from abroad in terms of employment permits that they've been given, the figures are extremely low. And I do think that's an area where we could do an awful lot better. Of course, we have to invest in the long term in delivering more OTs from our own college and third level system. But in the short term, similar to how we've done in maternity services, there must be a better way in which the state can try and recruit a larger number of OTs, SLTs, to deliver that direct therapeutic services in schools and to support all the needs of children that are required.
Like, share, and subscribe, and let us know your thoughts in the comments. We'd love to hear from you.